Okie doke. Hopefully during this football game my husband won't be screaming in the background, but if you hear a scream, it's not because I've tied him up somewhere. It's not. Anyways, so I keep getting asked about hair loss. I put out a video about it, I don't know, some time ago, but I really think I made it a little bit too long and I just ramble on and everything. So I'm going to try and do this one shorter and kind of just hit the high points and you know, whatnot. Anyways, so what is hair loss? Okay, you know, you're looking at your hair, you're thinking it's getting thinner, you're freaked out, you're like, is there bald patches, whatever. This is a problem that a lot of trans folks have, like an anxiety, a fear, a phobia almost, whether they're transmasculine or transfeminine. I will say up front, transmasculine people are going to be way more at risk for any kind of hair loss than transfeminine people. So, I mean, there's that. If you go on estrogen therapy, you actually decrease your chances of hair loss. So, hey. But anyways, so how to kind of check and make sure you're actually having hair loss, because this is something that people freak out about all the time. You know, there's that old guide of, oh, you know, you can lose up to about 100 hairs a day. So I mean, 100 hairs looks like a huge chunk whenever you're looking at it in your brush, like, and then your shower drain and you're like, oh my god, I'm losing so many hairs. A lot of times if you pull out just like 10 to 15 hairs, that looks like 50 hairs. Like, it looks like way more than it really is. So a lot of times I find people are really just psyching themselves out about this stuff. And they're just worried because they see crap on the internet saying, you're going to lose your hair. And it's the internet. People are weird. Take everything with a grain of salt. Even what you hear from me, you never know. I could be a crazy person. At any rate, so with regards to monitoring for actual hair loss, I always advise, number one, you know, if you see hairs on your pillow or something like that, or whatever, just if you're running your hands through here and you get some hairs, of course you're gonna have hair. Like, God, I just had like 3 or 4 break off just from that, get caught in my ring. But anyway, you're gonna wanna look and see, is the hair breaking or does it have the actual root or bulb at the end? So I mean, whenever you're looking at it, I'm not gonna pluck one out because I need all the hair I can get anyway. I'm always stressing and it's falling out. But whenever you're looking at the hair, if you can't find at either end that there's kind of like this little whitish gray lump or something at the very end, looks like a little bulb, that's the root of the hair, then it probably just broke. So I mean, you'll see a lot of, like, you know, the flyaway hairs or whatever, or you know, they kind of look frizzy, or like, you know, at each end it just looks like the end of a hair. There's not really anything attached to it. These are most definitely just like broken hairs, frayed hairs, whatever. You know, and if you're sitting there looking at it and you're like, I can't tell, is that like a root or not? If you can't tell, it's not. Like, it's hands down, whenever you're looking at the root of a hair, you can tell that it's not hair, that it's an actual root of the hair. And so whenever you're having hair loss, like actual hair loss, you know, they become very loose and the roots and hair follicles and everything just kind of separate and the hair will just fall out. As opposed to if you are running your fingers or a brush through it, or you're shampooing, or you're, you know, pulling it back in a ponytail and you get breakage, that's a completely different thing. Completely different. If you're having a lot of hair breakage, it's because you just have crappy hair, I don't know, like mine. And you need to take better care of it. Now, there are things that you can do to help, you know, good nutrition. Don't pull it back really tight into a bun or ponytail or any kind of hairstyles. That's going to put stress on the hair, you know, shaft itself, as well as the roots. And you just don't want to be overly like vigorous with your hair. Like, don't whenever you're shampooing it and whatnot. So be careful whenever you're handling your hair. That's going to help with like breakage and stuff. And then look at whatever product you're using, or if you're dyeing your hair a lot, that can really dry it out and make it more prone to breakage. So all of those good hair hygiene tips and stuff that you hear online from like Vogue magazine and everything like that can actually be very helpful to help with like hair breakage. And I find that hair breakage is more often than not the actual cause of, quote, hair loss, and not actual hair loss that my patients are afraid of. Now, that being said, you know, monitoring all that, good. You can also take periodic pictures, either like once a month at least is what I advise, and you want to do that at the same time of day in the same room, so it's the same lighting from the same position or angle. And then you want to do that for about 4 to 6 months and then look at the time change, because from one picture to the next you might have just parted it a little bit, or you had a bad hair day or something, so it's going to look kind of different from picture to picture, but the overall flow from the first picture to the end picture should be about the same-ish. So that's how you can track and really see, are you actually losing hair, or is it just kind of like, you know, it's in my head, which it's true, like it gets in people's head and you just like can't let it go. And it's because a lot of times this stupid crap we see online that's just kind of like putting these fears in us. I don't know why people get off doing that to people, but what are you gonna do? So anyway, so there's ways to kind of check and monitor if you're having actual hair loss, and to be aware of what actual hair loss looks like. Now, if you're having, you know, actual like hormonally based hair loss, this is going to be a little bit different, so to speak. Like I said, trans men are going to be way more at risk for this because they're going to be getting on testosterone, which can convert into DHT, dihydrotestosterone. DHT is going to be the main cause of what happens with hair loss when it's hormonally caused, not from like nutrition or breakage or genetics or something like that. Whereas trans women who are typically going to have their testosterone levels dropping, and therefore the reservoir from where DHT is made is then dropping, so that's going to drop the DHT levels in turn, so they're going to be at a lot less risk for hair loss. Now, why do so many people think they're losing their hair then, other than just it's, you know, kind of psyching them out? So when you go on hormone therapy, it's going to put your body under stress for about a good year, maybe even 2 years. And your hair is going to react to that like any stress you could ever go through. If you are stressed out because, I don't know, you lost your job and you're going through bankruptcy, you're about to lose your house, your car just broke down and it needs new tires, and your kid's sick and all that, that's a lot. And then you start eating poorly and whatever. Anyway, all of this stuff can lead to hair loss. And, you know, and it's from this enormous stress on the body. Similarly, going on hormone therapy, even though everybody's excited usually and happy about it, it puts stress on the body to go under that change, that huge of a change, to take one hormone in the body as the main hormone and drop it down and replace it with another. Your body's going to need to change, and it needs to adjust to that. And what you're going to see is some repatterning of the hair on your scalp. Whether you're on T or E, it doesn't matter. It's going to look a little bit different for each, whether you're on T or E, but it's going to be essentially the same process. So for example, someone who goes on E, and so they're dropping their testosterone, they're raising their estrogen level, they're going to see that this area right here, that in someone with a lot of testosterone in their body usually looks kind of cut out, that widow's peak thing, they may actually see this start to fill back in. But consequently also, while they're undergoing the stress of going on hormone therapy, they're also going to see probably a lot more breakage to the hair, maybe some hair roots falling out, because the body's going to be like, oh man, what's going on? This is crazy, you know, and it's going to be just kind of going through changes, and you're going to see that throughout your whole body. It is why you get mood swings and things like that. This is your hair's mood swing, essentially. So your hair can become more brittle, more prone to breaking. It can be easier for the roots to get pulled out during this period of time. And so you're gonna see a little bit more a little bit more hair shedding than what you're used to, probably for at least a year after getting on a full dose hormone therapy with either T or E, and maybe even up to 2 years. Kind of depends on the person and genetics and all that. But anyway, so 1 to 2 years, you're going to see this period of time where your hair is going to go through this fluctuation, and it's because your body is super stressed and it's trying to adjust to these changes. Now, it eventually will adjust, and that will slow down. You won't have to worry about all that anymore. But that is something to be aware of, is that, you know, when you go on hormone therapy, your hair is going to go through these changes, and it's not something that really you can do a whole hell of a lot about. Because, you know, if you were under a lot of massive stress, like financially, and that's why your hair was becoming brittle and falling out, well then if I gave you $1 million and solved all your financial issues, that stress is gone, great. Your hair will probably recover a lot quicker. Whereas with hormone therapy, it's not that I just give you hormone therapy and a week later you're done with your transition. No, your body has to adjust to it over time. So sorry, for 1 to 2 years you're going to be undergoing those stressful changes with your entire body, including your hair. Just like I said, all the basic hair hygiene things, like not putting a lot of tension stress on it, using good hair products, don't overbrush it, don't pull on it a lot with your fingers, don't vigorously scrub, you know, all those things. Do those, that will help during this time, but eventually, you know, things slow down and it will have repatterned itself, and you know, wherever it's going to grow in, it'll grow in, and wherever it's going to stay, it's going to stay. We're good. So with regards to trans men, when they're going on testosterone, you know, like I said, with trans women, you look here and they may start off with more of like that widow's peak thing, and then this may fill in. But on the other hand, trans guys that are going on testosterone may see that this area kind of falls out and goes into that little triangle thing there. And that freaks a lot of them out because they're like, oh my God, I have obvious evidence of hair loss. That's just your hair repatterning itself, and it's going to happen one way or the other. Like, you're not going to stop that. And again, same thing with trans men. Don't put tension, you know, don't over dye your hair. Look at the products you're using. Be kind to your hair, you know, get good nutrition and everything. And just be careful with it, because over time, this will slow up and stop happening. Now, one thing you can do if you're concerned that, you know, you are having an actual problem, you can have your DHT level checked on your labs and see, is your DHT level high enough to really be concerned about. And in general, I use a level of 30 to 40 as my upper cutoff for whether or not I think someone is going to have a problem with their head hair, as opposed to we're just worrying too much. So if I check someone's DHT level, I'm expecting it to be less than 20. If it's between 20 and 30, I'm just like, you know, whatever, keep an eye on it. If it's 30 to 40, then I'll tell them, you know, you're at some mild to moderate risk for DHT causing some issues. And if it's over 40, then I'm going to tell them you're at moderate to high risk for DHT causing issues. So it doesn't mean necessarily that DHT will cause them issues. It's just that it is now considered an actual possibility that it could be causing issues if your DHT is high enough. A low DHT level, like, is not even a point to worrying about hormonally caused hair loss. It's not going to be the DHT. It's not going to be any of that. It's probably just going to be the normal repatterning of your hair, and or other things in life like stress and poor nutrition and stuff like that. Now, what if you have genetic hair loss? That I am aware of, there's nothing that you can truly do about genetic hair loss besides like hair transplants and like, you know, paying for certain procedures and stuff. Anything I've ever seen has been basically snake oil that people are selling folks that have actual genetic hair loss to try and save their hair. I haven't seen anything work to any great degree. I've seen a lot of idiots online saying, buy my shit because it's gonna save your hair. No. Anyways, so genetic hair loss, I don't have a lot to comment about. I'm definitely not a specialist in that field, other than I just know there's not much I'm going to be able to do to help you with that. Now, as far as what can you do if you do actually have hair loss, or if you're just so concerned about it that it is taking over your daily life and you just can't focus on anything but it. So there are various medications such as minoxidil, which is the popular Rogaine, basically. There's Finasteride and Dutasteride, which are essentially the same medicine, although they do interact differently in the body. I'll talk about that in a second. There's other stuff such as like the Dr. Power's formula and these hair restore formulas that use all kinds of stuff like combinations of minoxidil and tea tree oil and antifungal stuff and anti-inflammatory stuff, and all of those are well and good to try. I've found that some people have some measure of success with it, but certainly not all. I guess it just depends on the person, like everything else. But anyway, so in regards to minoxidil, that can come as a topical or as a pill. I'm somewhat reluctant to put people on the pills just because minoxidil is a vasodilator, meaning it makes your blood vessels get big, which drops your blood pressure. And that's what it's meant for, is kind of like a third or a fourth line blood pressure medicine. So, you know, if we give you this medicine and it doesn't bring your pressure down enough, and then we give you another and another and another, and your blood pressure's still just not quite there, then someone might consider giving you something like minoxidil to help with that, just to get you down. But it's not really a popular drug for that, and therefore it's not a super popular drug, in my opinion, for as a pill anyway, for preventing hair loss. And if it is used for that, it is used in a very, 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 very tiny dose. Because you don't want to be using the doses that they normally use for blood pressure control whenever you're just trying to help with hair. And that's part of the side effects that can happen, is it can drop your blood pressure. So you want to be very careful if you do go on minoxidil pills. Like I said, I would consider that like probably a third line thing that I would try for hair loss. The others, like I said, Finasteride, Dutasteride, they have all kinds of names. Finasteride is usually one you'll hear more about. It's the newer of the two. Both of them interact with what's called 5-alpha reductase, which is found at various places in the body, including the scalp. 5-alpha reductase is important in the conversion of testosterone to DHT. And remember, DHT is what the hormonally caused hair loss is that everybody's worried about whenever it comes to hormone transitions and everything. So if you block the 5-alpha reductase from being able to do its job, then you won't have testosterone converting into DHT, which could then cause problems for hair. So both of the Finasteride, Dutasteride do that. However, Finasteride is considered slightly less effective, and Dutasteride is considered slightly more effective because it's more specific for a particular kind of 5-alpha reductase. Won't get too far into that because it's really dry and boring material, but just know that if for some reason you tried Finasteride and it was like, it might have been working, but not quite, you might try Dutasteride instead, and it may work better. One of the reasons people don't throw Dutasteride around a lot anymore is because it has a very prolonged half-life that can build up in the body over time. Just something to be aware of. And it's an older medication, and so, you know, all the older meds, they're like, oh, they have more side effects. Really, I think the older and the newer meds always have the same amount of side effects. It's just the newer ones haven't had enough time for us to discover all of them. But anyway, just something to be aware of. And then, like I said, things such as, these hair restore formulas that have like all these different things included, like an anti-inflammatory, antifungal, minoxidil may be mixed in there, and Finasteride topical or Dutasteride topical can be mixed in there. There's all sorts of things that can be mixed in, usually in something like tea tree oil. And then they'll put something like menthol or peppermint or something in there to make it not stink. And give you that nice tingly feeling whenever you put it on your head. But anyway, those are, like I said, those are great. They're to varying degrees of success. I've never seen total success with any of those. But I mean, hey, you know what? If you want to try them, try them. For the most part, they're not particularly harmful, but there is something to be aware of with topical minoxidil, and that's Rogaine essentially. So topical minoxidil, if you remember when I talk about a pill, it's a vasodilator. And as a vasodilator, it's going to make your blood vessels expand. Well, that's going to bring more blood to your scalp. That's great. It also seems to interact with a particular part of the phases of hair growth and development. And so it helps spur on the hair follicle growth and development at a certain phase in the hair's growth. That one, like I said, I'm not a hair expert. I just stayed at a Holiday Inn Express last night or whatever. But no, So it tends to attack it from two angles. One, it seems to help in a particular phase of hair development, and it dilates the blood vessels, bringing more blood to that area of the scalp, therefore feeding the follicles more of the nutrients and oxygen and everything that they need to be nice little healthy hair follicles. But something to be aware of with minoxidil is that it is very toxic to cats. It's toxic to other animals as well, but like for dogs, if they, I don't know, licked it off your head, it might make them sick. You know, they might throw up or something. But in general, it's not going to be near as bad as if a cat, you know, you're sleeping in bed and your cat gets up there. You know, cats, they're weird. They might just lick your head or whatever. It can kill cats, so be very careful about that. You don't want to like put it on and then you have it on your hands and you don't wash your hands and you're playing with your cat or whatever and it licks your hands and it gets sick or dies from coming in contact with minoxidil. So be very careful with minoxidil topical. If it's mixed in anything that you're putting on here, or if it's the only ingredient or whatever, such as like with Rogaine. Let's see, one more thing just to mention before I conclude this video that ended up longer than I wanted to again, is to be careful with these B vitamin supplements. A lot of people, they want to try and take, you know, better nutrition type care of themselves, and they'll see that, oh, if I take you know, niacin, that's, you know, a B vitamin, and they'll see that it is listed as being good for hair growth. Well, that's nice and everything, but do be aware that one of the side effects of niacin just, you know, is flushing, so you get like hot flashes for no reason. But what I really want my hormone therapy people to know is that these B vitamin supplements, especially like niacin and whatnot, can cause I was trying to think of something not to cuss, but basically it fucks up your labs. It can cause pseudo elevations or depressions on your testosterone and estradiol levels. So whenever you're taking these kind of B vitamin supplements that are meant for hair stimulation and growth, you want to make damn good ensure that you stop taking them at least 7 days before you have your labs drawn. Preferably you stop taking them 14 days before you have your labs drawn, but at least 7 days before, so that we don't get these wackadoodle lab values and wonder why in the hell you're doing everything right, but your levels are just stupid low, and who knows, you know? And I mean, a lot of times patients don't think to mention that they're on these supplements because what's the harm, right? It's just a supplement, it's just natural or whatever. It actually can have a huge effect on your lab values, and it has something to do with how the labs are actually tested in the laboratory as to how it just screws up with the measurements and everything. But again, interesting but kind of dry and boring, and this video is long enough as it is. So I'm going to conclude, just say take very good care of your hair, take very good care of yourself, monitor to make sure you're having actual hair loss and not just breakage. And then, like I said, you can check a DHT level. If you have genetic hair loss, you got to go see a specialist for that to see what your options are. And then while there are medication type options out there, they do have their pros and cons with them. Be very careful whenever you're evaluating what you want to start on and try, and always, always, always start on the lower doses just to be sure you tolerate things okay. Okay then, I hope that this was it and I didn't miss anything, or else I'll have to record this all over again. Oh my God. Okay, y'all have fun. I hope this helped someone.